Welcome to the Addiction Recovery Place, the podcast champion addiction treatment specialists around the globe. I'm very pleased to introduce today's guest, Dr. Pamela Tambini, a board-certified medical internist. In addition to her role as Chief Medical Director in Florida, she continues to practice internal medicine and is also the co-host of the Real Recovery Talk podcast. Welcome to the podcast, Dr. Tambini, and thank you so much for joining me today.
Thank you for having me. I appreciate your time.
No, it's great to have you here. So we're going to jump straight into just some questions today. So tell us about your journey and about your career and kind of how you got to where you're at now today.
Okay. So my original track was internal medicine, the residency here in the United States. With that residency, I had a lot of exposure to substance use and addiction medicine. On top of that, addiction is very close to me. My father had a lot of mental health issues, but also had a gambling addiction. So kind of lived through as a loved one experiencing it, right? And then I also, on the other side of it, learned as a provider. And that kind of sparked my interest. My father passed away about 10 years ago now, mental health related, gambling addiction related stuff. And so that's what really triggered me to go head, on into the field.
Mm-hmm. Okay. So how long have you been practicing?
So I've been practicing about 8 years.
Okay. And where did you start? Where did you start your career from? Because you're based in Florida, obviously. So
Yeah.
have you always been based in Florida? Based in Florida?
Based in Florida. And then Florida, I would say, is the hub. It started the treatment realm for treatment centers in South Florida where I live and train. Mm-hmm. So I got, my feet wet in that. And then a few of the other places that I do some consulting for are in Georgia, Tennessee, Mississippi, all over the Southeast United States.
Mm-hmm. So you're very busy.
Very.
So what addictions do you help treat specifically? What are kind of specialities that you help yourself?
All of them, primarily substance use. So every single substance that you can think of that falls in the DSM-5 or the ASAM criteria, all of those things.
Okay. So what are your views on harm reduction? Because it seems such a wide range of options around treatment. Do you believe that this is an effective treatment model for addictions, harm reduction?
So that's a very debatable topic, but I've kind of learned working in this field, what we do and how we provide care is harm reduction.
Yes.
Because you are providing care for people who are in harm's way. Mm-hmm. Do I personally practice harm reduction? I would consider Suboxone maintenance, Sublocade injections, Vivitrol injections, stuff like that, harm reduction. Mm-hmm. With relation to harm reduction in terms of needle exchange programs, the things that go out of my practice realm, I think what people are doing to help, whether it's overdose prevention of communicable diseases like HIV, hepatitis C, homelessness, I think it's great for what they do. I just don't partake in that side of harm reduction.
No, excellent, because it's such a wide-ranging subject. I think people. I mean, I'm from England. We have a very different approach to harm reduction. To say that some places here in America that I've been kind of getting to know. So it's quite interesting. I always ask everyone about harm reduction and kind of where they're at within their state and within their profession. Right. What do you consider to be some of the best treatment options for addiction to stimulants and not opioids? What practices would you say work the best for that?
Like in terms of medication management or just
general treatment, kind of therapy groups or,
Yeah. So stimulants, just like any other substance, I think the biggest things are going to be group therapy, obviously, individual therapy for understanding their own personal demons when it comes to their addiction. And there's a lot of programs out there that the 12-step programs. So you have NA, Smart Recovery, Celebrate Recovery that are not necessarily 12-step based, but everyone has to find what works for them in terms of working a program, because that's very important for people.
Definitely, definitely. Okay, so everyone knows and understands that many people who are affected by addictions are in full-time work, be it the pressures of work or the pressures in life in general. How does
Mhm.
someone who is in full-time work manage to access treatment for their addictions, and what are the options that are available to them if they're in, doing a 40-hour week?
So if they're a working professional, obviously their addiction, I'm sure it's, again, I can't gauge the level, but it hasn't harmed them enough to interfere with what they're doing with work. Some people are unwilling to give up work. So you have to kind of meet the person where they're at.
Yeah.
Regarding that specific question, there are outpatient programs where that work with patients and, they can do 3 days or 5 days a week where they work with their work to get them on a reduced work schedule.
Mm.
If they have to maintain the 40 hours a week, a lot of facilities have night programming and night groups and night therapy, even weekend, in order to help accommodate the person where they're at.
Mm.
New spark in treatment that's coming about that I think many people will see is virtual outpatient services.
Mhm.
So virtuals may be a little bit easier for people. They don't have to travel somewhere or live somewhere that's not their home, and they can do Zoom or, any other HIPAA compliant form
Mhm.
to complete their treatment.
Mhm. Did you see a boom around, especially around COVID, with the virtual therapy idea to have you seen that grown since, say,
Oh,
2021?
yeah, exponentially. Whether it's just, counseling therapy, but addiction, a lot of the treatment centers down here that I work with or that I've been exposed to are now starting. Well, they did start back then. It wasn't so heavy, but it's really starting to boom now
Mhm.
because of that.
Mhm. So I guess that's made access to treatment kind of a little bit easier for people as well, since obviously the pandemic and how kind of Zoom has had a big impact within connecting with therapy around the world. So no, that's great to hear. Do you promote the 12-step program yourself? And which tried and tested model, which has proven very successful in overcoming addictions for many, many decades?
Mm.
What is it, in your opinion, that's made the 12-step program so widely accepted and used with huge success?
So twofold. One is, do I promote it? Definitely.
Mhm.
Again, I don't try to push anything on anyone. I just try to educate, break barriers with people, whether it's patients themselves or family members and loved ones,
Mm.
whether it's AA or NA or the other, Celebrate Recovery or Smart Recovery. If people don't, want to get into too much spirituality,
Mm.
I try to let them know it's a group of their peers
Mm.
and they're isolating, lacking support. And the easiest thing to do, because there's meetings every day, all day, anytime, to lean on if they're not willing to do treatment or, maybe they just relapse and don't want to go back to treatment. That's something they should really, because you meet people, you gain support, you build sober support and a sober community, which is very important.
Mhm.
For loved ones and family members who are supporting those through addiction, I do tell them about Al-Anon because addiction is taboo. It doesn't matter where you live or where you come from.
Mm.
I tell everyone it's like cancer. It doesn't discriminate.
Mhm.
So a lot of people don't like to talk about it. And it's still to this day in the world we live, people don't want to acknowledge it, I guess.
Mhm.
So it gives them a safe space to go into to learn more about themselves and about the person that they're trying to help.
Mhm. Do you
So that's what I've tried.
Yeah. Do you feel that addiction is becoming easier for people to talk about, whereas 20, 30 years ago, it was it was very taboo in England, certainly. And do you think it's become easier over the last, say, 10 years to discuss addiction and be more open about it?
In a way, I mean, if you live in South Florida where addiction, is all around us,
Yeah.
it's a very open thing. But if you go to, let's just say like Alabama or the very southern religious
Mm.
states, you know, those places, it's still not easy to talk about. It's still taboo. And it across the United States, it's going to ebb and flow based upon where they're at and how they were brought up.
Mhm. Yeah, it's quite. I live in Iowa, and it's quite taboo here as well. So I know exactly what you're talking about. So okay, excellent. It's not only adults that you help treat with addictions. Have you seen any new trends in drug use amongst the younger people that you help treat that are so sadly affected by addiction? Have you seen any kind of new drugs or new kind of ways kids are getting access to their drugs because of the online stuff as well?
The biggest thing we're seeing are like fake, what we call fake or pressed pills, such things like kids, maybe they're experimenting and they think they're buying a Xanax bar
Mm,
from someone,
mm,
but the Xanax bar is not Xanax, it's fentanyl that was created, what, in any other, China, wherever they bought
mm.
it on the black market or the dark web,
Yeah.
and they think they're buying Xanax, and then, you have 16-year-old kids, 17-year-old kids that are overdosing.
Mm,
So I would say that has been a big issue in the last couple of years,
mhm,
especially down here that we're seeing.
mm,
Even patients coming into the treatment centers, they're saying, "Oh, I was using Xanax and Valium and Klonopin," and their urinalysis comes back and it's just fentanyl. And they're shocked because
mm,
they're like, "Wow, I could have died, one,
mhm,
two, obviously I didn't know what I was buying from the street or the dark web."
mhm.
So that's a big problem that's come about.
So you've obviously noticed there's big new trends within drug use around fentanyl. Is it a major problem, would you say, in Florida?
Definitely.
It is.
It's
And
a huge problem.
yeah, I mean,
Yeah.
it seems to be growing around internationally now. I mean, I think we're even getting it over in England, which I was quite surprised at. So how do you help those that are affected by fentanyl? What's the kind of, what are the options for them? I mean, it's such a destructive substance.
It is. So there's multidisciplinary approach,
Mm,
right? If it's in a treatment setting, you have your medical team, you have your clinical team, which is comprised of a therapist
yeah,
where you have concurrent medication management, therapy groups, things like that. If it's in the outpatient setting and they're just going to like their primary care doctor, most doctors will also refer to a therapist because patients need the best of both. Medication wise, there's people who choose abstinence-based, treatment, but that's very hard because your risk of overdose is there.
mhm,
Medication management, most people have seen methadone,
yeah,
buprenorphine, which is Suboxone
yes,
maintenance,
mhm,
Sublocade, which is the injection. Those are partial opiate agonists
yes,
that are, and then you have your opiate blockers,
mm,
and that's naltrexone or Vivitrol medication management. And then we also try to concurrently manage if they're suffering any mental health issues, such
mm,
as depression, anxiety, sleep issues, whatever might come along with it.
mhm. Okay. Okay, excellent. Can you tell our audience about any of the other therapies that you offer or that you strongly help promote?
So, therapeutically or personally, because I'm a physician,
Yes.
medication management's big for me.
Mhm,
Motivational interviewing is a big thing for me to help people understanding the stages of change, the trans theoretical model,
mm,
and understanding where you're meeting a patient where they're at in their addiction
yeah.
is important. But some of the things the treatment centers offer are, cognitive behavioral therapy,
Mm,
group therapy with psychosocial skills. People forget or lose the ability to like get up, have a job, make a schedule, time management. So these are the things we help people reintegrate into life
mhm,
with, or financial management, things like that.
mhm,
Trauma therapy, EMDR,
yeah.
dialectical behavioral therapy or DBT for patients who have a personality disorder.
Mm,
So there's so many realms that we have exposure to and offer.
wonderful. That sounds absolutely fantastic. So what are your future plans for your career or your work? What have you got kind of in the pipeline?
Future plans. I have no future plans of leaving the addiction medicine realm. I plan to continue to work in the field. One of the things that I started doing as well is the Real Recovery Talk podcast.
Yes, that's good.
We're trying to provide a program for people with addiction, their families and loved ones. So support programs to help educate,
Mhm,
people like promote guides, family therapy, things like that.
Mhm.
And then eventually I want to be an educational provider to other, physicians, nurse practitioners, physician assistants in the field
Mhm.
to help guide them and educate them to break barriers so it's a more common practice.
Mhm. That sounds like you're gonna be very, very busy. So, tell where could people find your podcast as well? If
And on any Spotify,
Mhm.
YouTube, Apple,
Okay, and who do
it's
you
called Real Recovery Talk.
okay, so who do you have on as guests for your podcast?
Anyone in the field. We have people themselves who've been in addiction, who are now in recovery,
Mhm.
and they share their stories.
Wonderful.
We have professionals in the field
Mm,
that are currently working, or that I've worked with or my team has worked with.
mm,
And even people who don't necessarily work in the field but are prominent in other fields, like, because I like to focus on exercise, nutrition, things like that.
mm,
So people who are in that field that are also in recovery, that can share their stories and how alternative therapies benefit them.
mhm. Wonderful. Excellent. So, how can people needing support for their addictions find you online, and how can they contact you or your service directly?
They can reach us at, I have the website, so
Mhm.
realrecoverytalk.com.
Yep.
I also have an email, info at Real Recovery Talk is our email that they can reach out to us, send us an email. If they're looking for help for themselves or for loved ones, we're more than happy to. We read all our emails, we, respond and
Mm.
go over everything.
Excellent. No, thank you very much indeed for that. Last question. Is there anything else that I should ask that I've maybe forgotten to tell you that you'd like to tell our audience about?
No,
No?
just that. I mean, I would say to everyone who is not a believer, addiction is a chronic disease. And the way that I look at it is like someone who has high blood pressure or diabetes. It's something they're going to face for the rest of their life, and they have to work at it. And they need support of their family members and their loved ones to get them through. And we're here to provide that support for people.
Well, I'm sure many, many people are glad that you're there doing the wonderful work that you do, Dr. Tambini. Thank you very much indeed for your time today. And we'll catch up again soon. All right. Thanks very much.
All right.
Cheers. Bye.
Thank you.
Bye.
Bye.